This episode is brought to you by Bumble. So, you want to find someone you're compatible with, specifically someone who's ready for a serious connection, totally open to having kids in the future, is a tall, rock-climbing Libra, and loves rom-coms with vegan pizzas on Tuesdays just as much as you do. Bumble knows that you know exactly what's right for you. So whatever it is you're looking for, Bumble's features can help you find it. Date now on Bumble.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hi, Jess.
All right, so today we are going to talk about diaper rashes. The clock is ticking, so let's get to it. Dina, what is a diaper rash?
Great question. So it's one of the top calls we get, and it's so common. About a half of babies will get a diaper rash. So it's often a red or pink-looking inflamed skin by the diaper area. It's most likely a contact rash caused by being irritated by urine or stool. It may cause babies to be in pain when you change their diaper. One of the biggest things to help is changing diapers frequently, which we know often is hard to do, especially when your baby is having diarrhea, which is one of the main culprits of diaper rashes. When changing a soiled diaper, I always recommend to pat, not rub the area, which is a common thing that we often do because we want to rub off all the stool, but that is often denuding to the skin. So it's better to always pat and to use a chemical-free, fragrance-free wipe. Or you can even squirt the area down with a water bottle or dunk your little one in a little bathtub to remove any soiling. I always also recommend to air out that tush as much as possible. So after wiping your baby, leave her on a clean towel or one of those medical chucks that we have in the office for a few minutes to dry out. It sounds silly, but you can even put a hairdryer in the cool setting and dry the tush out for a few seconds, a few inches away from the tush. I also love Desitin or any cream with zinc oxide in it. So there's two types of Desitin, a blue and a purple version, and the purple version has a maximum strength of zinc oxide in it, which is about 40%. And the key is really frosting your baby's butt with that cream. Like you really want to think about putting on that cream like a cupcake almost. So it's a really thick layer. You want to see that white cream on the baby's tush. And you don't have to rub the layer raw off before changing diapers. Just remove the soiled part off and apply more cream to it. If that's not helping, of course, talk to your pediatrician about using other creams too. Sometimes we also recommend things like steroid creams, like over-the-counter hydrocortisone, or a different mixture, concoction of creams like A&D and Desitin and antifungal cream, along with a dash of Maalox sometimes. But of course, talk to your pediatrician first always.
Okay, I love that you described it as frosting the baby's bottom. Okay, so if the rash still isn't going away, can it maybe be more than just a regular diaper rash?
Yes, of course. So if it's not going away in a few days with regular treatments, then we start thinking of something different like fungal rashes. And this rash looks like a bit different and it looks more like a bright red or pink patches with sharp or clear borders around it. It also may have bumps on it, which we call satellite lesions. It could be in the diaper area, but also in the groin area. And for this, besides adding a cream with zinc oxide in it, talk to your pediatrician about also using an antifungal cream like over-the-counter Lotrimin, which is used for athlete's foot. And there's no specific baby version of it. And you want to use this cream about 3 times a day until the rash resolves. And I even recommend using it for a week or so after the rash resolves just to make sure it's all gone.
All right. Are there any other rashes that need to be seen by a medical professional?
Yeah. So the other big thing we worry about, of course, is infection. So this is a bacterial infection with staph or strep. So we worry about a strep infection when there's a classic, this bright red rash around the anus. There's also impetigo, which we worry about, which is a yellow, crusty type lesions. We often describe them as honeycomb type lesions that are a sign of a bacterial infection. So if there's any concerns, you need to see your pediatrician who may determine if you need some topical antibiotic or an oral antibiotic is needed to clear up that diaper rash.
Wow, I really wish that I had listened to this when I had babies in diapers. All right, well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.